One of the biggest science experiments in the world is now underway in Dallas. It is a bold effort to gather data from 1 million people, and the ultimate goal, to improve your health. Here's Jason Whiteley.
So, any fear of needles? Oh, I like this one very nicely.
I'll walk you through every step.
Doing okay?
Statistically speaking, Melissa Hoffman is 1 in a million. Nothing's wrong with her. She volunteered for this.
You just come in, you answer some questions, and they draw your blood. What could be easier than that?
Her answers and her blood will help build the biggest medical database in the world. It's called All of Us, a study started by the National Institutes of Health, and Baylor Dallas one of the first stops. The study is just starting. You'll soon see billboards and TV commercials over the next 6 months, trying to recruit more than 1 million people all across the country over the next 5 years. Researchers wonder whether they can find a gene that, say, causes cancer, diabetes, or even heart disease.
Can we see how many people in the United States have Huntington's genes? I mean, that's a pretty rare disorder, but when you test 1 million people, you'll be able to find that gene. How often is that gene present, but maybe not causing Huntington's disease?
And that's the kind of data that doctors hope to determine.
I think that this is data that can have an impact to society at large, because it may help them lead to discoveries of different things that maybe genetically are going on that lead to underlying conditions. And then that can also help scientists come up with cures or treatments for those conditions.
The study could also change the way that doctors prescribe medicine, helping them pinpoint what your body will respond to rather than just give you a drug known to treat a certain disorder. It'll take 1 million people like Melissa Hoffman to complete this study, but the information it generates stands to benefit so many more.
Sounds good.
Jason Whiteley, Channel 8 News.
The study is still in its initial testing period, so it's not open to the public yet. You can still sign up to be on the waiting list. We've posted a link in Jason's story for you on WFAA.com.